The fluorescent lights of St. Mary's Hospital hummed softly as Elena Rodriguez adjusted her scrubs and prepared for another night shift in the pediatric ward. 8 years she had walked these corridors, tending to sick children with the same gentle care and unwavering dedication. To her colleagues, she was simply the quiet night nurse who never complained, never missed a shift, and somehow always knew exactly what each child needed, before they even asked. But Elena carried a secret that weighed heavier than any medical chart, a secret forged in the mountains of Afghanistan, in the dust and chaos of firefights, in the screams of wounded soldiers she had pulled from the edge of death. She was an Army Ranger medic, one of the few women to serve in that elite unit. Trained in combat medicine and survival tactics most people couldn't imagine. She had left that life behind, or so she thought. The transition to civilian nursing had been her attempt at normalcy, at finding peace in healing rather than in the adrenaline-fueled urgency of battlefield medicine. The children never knew that their soft-spoken night nurse could field strip a rifle in 30 seconds, or had once carried a wounded soldier 3 miles through enemy territory. It was just past midnight when Elena noticed something unusual. A man in a maintenance uniform lingered too long near the stairwell, his eyes scanning the ward with an intensity that didn't match his supposed job. She felt that old instinct kick in, the same sixth sense that had kept her alive through 3 tours of duty. Something was wrong. She continued her rounds, checking on little Tommy in room 4, who was recovering from appendix surgery, then Sarah in room 6, who was battling leukemia. But her awareness never left that maintenance man, or the 2 others she had now spotted on the floor. They moved with military precision, and their uniforms, while convincing at first glance, were slightly wrong. The patches were outdated, the fit too tactical. Elena's heart rate increased, but her hands remained steady as she administered medication to 8-year-old Marcus. Years of training had taught her to function in chaos, to think clearly when others panicked. She activated the emergency alert on her phone, a discreet signal to hospital security, then continued her duties as if nothing was amiss. The situation escalated quickly. The maintenance men dropped their pretense, pulling weapons from their toolboxes. Their target became clear as they moved toward the private wing where Senator Harrison's daughter was recovering from a routine surgery. This wasn't random violence. This was an assassination attempt. And these men were willing to go through anyone who stood in their way. Elena's mind flashed back to the briefing rooms, the tactical scenarios, the countless hours of training. But this wasn't a military compound or a battlefield. This was a pediatric ward filled with innocent children, many too sick to move, some too young to understand danger. There would be no air support, no backup team of rangers. Just her training, and the desperate need to protect those who couldn't protect themselves. The first gunman rounded the corner. Near the nurse's station, Elena had already moved, positioning herself between the armed intruder and the corridor that led to the patient rooms. Her voice was steady, calm, almost eerily quiet. She told him to take a step back, hands visible, weapon down. The gunman laughed, underestimating the small woman in blue scrubs standing before him. That was his first mistake. Elena's muscle memory took over. Years of hand-to-hand combat training flowed through her movements like water. She disarmed him in seconds, using his own momentum against him, redirecting the weapon away from the vulnerable patients behind her. The rifle clattered to the floor as the man stumbled backward, shock replacing his arrogant confidence. But there were more. 3 gunmen total, now alerted to the resistance. They moved as a unit, trained and coordinated. Elena grabbed the fallen rifle, checking the magazine with practiced efficiency. She had seconds to make a decision that would define the next critical minutes. Engage and protect, or retreat and hope security arrived before the gunman reached their target. She chose to fight. Using the hospital's layout to her advantage, Elena moved through the corridors like a ghost. Every corner, every doorway became a tactical position. She shepherded frightened nurses and patients into secure rooms, barricading doors and issuing quick, authoritative instructions. Her voice carried the weight of command, something her colleagues had never heard before, and they responded instinctively to her leadership. The second gunman appeared from the east stairwell. Elena was ready. She had positioned herself with clear sightlines and cover, using a medication cart as a barrier. The confrontation was brief but intense. She didn't want to kill anyone, even those who had come to do harm, so she aimed for extremities, disabling rather than destroying. The training that had once been about eliminating enemy combatants now focused on protection and minimal force. Asterisk. Hospital security arrived but found themselves outmatched by the military-grade weapons and training of the remaining intruders. Elena coordinated with them, using hand signals and tactical positioning to create a defensive perimeter around the most vulnerable patients. She was no longer just a nurse. She was a soldier again, fighting not for territory or political objectives, but for the lives of children who deserved to grow up, to laugh, to live. Asterisk. The leader of the group, the most dangerous of the three, made his way toward Senator Harrison's daughter's room. He was professional, controlled, and clearly experienced. Elena intercepted him in the corridor outside the private wing. They stood facing each other, her small frame somehow commanding the space, his larger presence suddenly uncertain. Asterisk. He demanded she move aside. She refused. He raised his weapon. She didn't flinch. The standoff lasted only seconds, but in those moments, Elena saw his hesitation. He hadn't expected real resistance, certainly not from a nurse in a pediatric ward. He didn't know he was facing someone who had survived ambushes, who had held the line when others retreated, who had earned her place among the elite. Asterisk. The final confrontation was swift. Elena used the confined space to her advantage, turning the corridor into a tactical nightmare for the gunman. She neutralized his weapon advantage through close-quarters combat techniques, disarming and subduing him before backup arrived. When police finally flooded the floor, they found 3 incapacitated intruders and a pediatric ward full of safe, protected children. Asterisk. The aftermath was surreal. Hospital administrators, police detectives, and eventually federal agents descended on St. Mary's. Elena's secret spilled out in witness statements and background checks. Her colleagues stared at her with a mixture of awe and disbelief. The quiet night nurse who brought extra blankets and told bedtime stories was also a decorated Army Ranger who had just single-handedly stopped an assassination attempt. Asterisk. Senator Harrison arrived at the hospital, tears streaming down his face as he held his daughter. He tried to thank Elena, to express gratitude for saving not just his child, but dozens of other innocents. She simply nodded, uncomfortable with the attention, more concerned about checking on her patients and ensuring they weren't traumatized by the night's events. Asterisk. The children, resilient as always, turned Elena into their hero. Little Sarah drew pictures of Nurse Elena, the soldier. Tommy told everyone who would listen about the brave nurse who protected them. They didn't fully understand the danger they had been in, but they knew Elena had kept them safe, and that was enough. Asterisk. Media attention followed, though Elena refused most interviews. Her story spread regardless. The veteran who left combat behind, only to find herself fighting again. Not for medals or recognition, but for the innocent lives entrusted to her care. Some called her a hero. She called herself a nurse doing her job. Asterisk. The hospital offered her recognition, awards, even a promotion. Elena declined most of it. She wanted to return to her night shifts, to her patients, to the quiet routine of healing rather than fighting. But things had changed. Her colleagues saw her differently now, not with fear but with profound respect. They understood that the gentle hands that held scared children in the night were the same hands that had defended them against armed intruders. Asterisk. Elena's past and present had collided in the most unexpected way. She had tried to leave the warrior behind, but when innocence faced evil, her training and her courage had emerged to protect those who needed her most. She realized that being a soldier and being a healer weren't separate identities but different expressions of the same commitment to protecting and preserving life. Asterisk. As dawn broke over St. Mary's Hospital, Elena completed her shift report and prepared to go home. The pediatric ward was quiet again, children sleeping peacefully, unaware of how close danger had come. She paused at the nurse's station, looking down the corridor she had defended just hours before. No bullet holes marred the walls, no blood stained the floors. Just another night in the pediatric ward. Except everything had changed. Asterisk. Elena Rodriguez walked out of the hospital as the morning shift arrived. Her secret no longer hidden, but her mission unchanged. She would return tomorrow night and the night after, bringing the same gentle care to her patients, the same watchful protection, because some heroes wear combat boots, and some wear scrubs, and the rarest ones know how to wear both.